And good morning to you all again. I'm Mabel Jong. This is WHCC TV coming to you from Washington, D.C. And we're rounding out our last interviews here. We just can't close out the studio with a good political pulse check. And with that, I'm going to turn it over to Dr. Robert Moffit, who is a senior fellow at the Heritage Foundation.
Right.
Dr. Moffit, thank you so much for your time.
It's great being here.
Well, the nation is certainly polarized on health policy,
yes.
As with many other issues.
Yes.
But it's unlikely that a major health care reform proposal will happen before the 2020 election. Am I right?
I think that's correct. I think that the divisions between the House and the Senate and the divisions between the House Democrats and the White House are so deep and so fundamental that it is unlikely that we are going to get some kind of major legislative measure through the Congress that is going to have any kind of major consequence for the healthcare system between now and 2021.
Well, there doesn't seem to be a day that doesn't go by with the administration criticizing Obamacare and trying to put in a new and better system in place. What do you think could happen before the election?
What I think could happen is that I think what will happen is we'll have a messaging battle between the Republicans in Congress and the White House and the House and Senate Democrats, where they will try to basically convey to the public their vision of what the healthcare system should be. I would expect that the president, for example, I would like to see the president outline a vision for healthcare, although he's been focused primarily on tax and economic policy. But I think as far as actually getting something done, I think there are limited areas where this could happen. I'll just mention three of them that I think make sense. There seems to be a very strong bipartisan concern about surprise medical billing. People getting bills that simply flabbergast them. They're so dramatic. And this is becoming a problem all around the country. And there is an interest, both in the Congress and in the White House, in doing something about it. President Trump recently ordered his senior executives to investigate the surprise medical billing problem and come up with a way to stop it. At the same time, in the House, you have House and Senate, there are about 7 different bills, primarily introduced by Democrats, to deal with the issue of surprise medical billing. They differ from one to another. Usually it's some kind of a government rate setting system for people who get these bills outside of network. At the same time, Senator Alexander in the Senate has been working with Senator Patty Murray of Washington State. And Senator Alexander called for 400 recommendations to make changes to reduce cost. I am certain, in fact, I know for a fact, that one of the issues that they're going to focus on is surprise medical billing. So I think you're going to see action. If you will see a compromise, because there seems to be a coalescence of interest on this, I think this is one area where you could see some real progress. Another area would be this whole issue of gag clauses. Where doctors, for example, are forbidden to discuss price and quality data, with employers or patients. I think there is a very strong opposition to that practice, and I could see something happening there. Price transparency is another area. The White House and the Secretary of HHS have made it a major initiative. How exactly they're going to go about it is a little different between what you see in the House and Senate, but nevertheless, I think price transparency is an issue whose time has come. You're starting to see price transparency initiatives at the state level. I think you will see something in Congress this year on price transparency, specifically with hospitals. The administration has already proposed basically providing a requirement that Medicare hospitals provide the list prices of medical procedures. Some of us feel that actually is not the best option. Actually, that some of the better options are at the state level, where they look at the total cost of hospital prices in terms of how they affect patients. So there's a lot of areas where you could see these are not big changes, big structural changes, but they are marginal improvements to the system, and I think you could see those kinds of things happening. Price transparency, surprise medical billing, and I think perhaps in prescription drugs.
Okay.
Prescription drugs. The president and the administration has come out with the proposal to eliminate the rebates between, in the Part D program and Medicare. I would not be surprised if you saw that expanded to the commercial market. The rebate, as you know, is that in effect a kind of a kickback. What happens is that what the administration wants to do is replace the rebate with a discount for the seniors when they go at the point of sale, and that would reduce their cost. The administration could administratively make changes at that level, but in order to make a broader change, they would require legislation and cooperation with Congress.
Well, speaking of Medicare, many progressives are deeply committed to Medicare for all legislation.
Right.
It makes a great headline.
Oh, it sure does.
Gets everybody really riled up. But the prospects this year are not good for passage of this.
I don't think so. I think Nancy Pelosi is riding a tiger on this. More than half of House Democrats have endorsed Medicare for all, and you're quite right. It gets people riled up. It's a very attractive idea. Universal health care coverage. It's free at the point of service. No co-payments, no deductibles, no premiums, right? No messy managed care networks. Sounds great. Who could possibly be against it? But Speaker Pelosi also knows that when you start to getting into the details and you start talking about the trade-offs, that's when the program starts to run into real trouble with the general public. You're familiar with the Kaiser study. The surveys indicated, 56% of Americans say they support Medicare for all. But once you say that it means the end of your job-based insurance, or it ends any kind of private insurance, then they start to oppose it. If you say, well, it's going to raise the taxes, they oppose it.
Right.
And then if you say that a universal system means that there will be some delays in your access to certain types of care, well, then it's 70% of the population opposes it. So Speaker Pelosi has a problem here, I think. Does she bring that to the floor? My guess is she does not. But there will be hearings. We had a hearing yesterday before the Rules Committee. There will be hearings in House Ways and Means and the Energy and Commerce Committee. But it'll be a messaging battle, I think.
Yes. Before we wrap it up, anything I'm missing that you want to point out? Anything that we should be watching for?
I think the issue for the president and for the Republicans is to craft a competent legislative alternative to the existing status quo. And I think there's a way to do that. I think what they ought to focus on is legislation that will lower cost, expand choices, stabilize coverage, right, and assure access to quality care. They cannot repeat the 2017 disaster they had, where they didn't have a coherent vision, and they had a Congressional Budget Office reports that indicated higher cost and people losing their coverage over time, or fewer people having insurance. So they've got to do that. I think there are a number of ways of doing that. I think one thing that they could do is to take the existing funding, which is huge in the Affordable Care Act, $1.6 trillion, and send that back to the states in a block grant on two conditions. One is the money must be used to offset the cost of low-income people who could not afford insurance, and two, that the money must be used to offset the cost of people with pre-existing conditions. Giving the states greater authority to re-regulate the insurance, which they've done for many decades, and at the same time expanding the choices that people have. For example, if you're in Medicaid and you feel that you could get a better quality of coverage, better access to physicians, superior quality care with a private plan, you should be able to take the money that you're getting from the Medicaid program, or the amount that is allocated to you, and redirect that toward private coverage of your personal choice. That would make a big difference, I think, for a lot of people.
Right. Okay, Dr. Moffit, thank you so much for that political pulse check. It's great to see you.
Good to see you. Thank you, Mabel.
Thank you. And we thank you for watching. Stay with us.